Hello and good morning or good evening, wherever you might be in the world. Hope you are well today and whatever time of day it is for you. Now, today, this is a resilience show. If you've not met me before, I'm Karen Bartle, and I'm going to be hosting a show today with special guest, Dr. Evelyn Chang. Hi, Evelyn. How are you?
I'm good, thank you. How are you?
Good, thank you. So we are both neighbours. We are both pretty much near to each other here on the beautiful Sunshine Coast in Queensland, Australia. Although a lot of folk on the coast here have not had a beautiful time of late because in southeast Queensland we've had so much rain. We've got torrential downpours and floods going on. So shout out to all those people that are suffering at the minute. We know we're with you. We're there with you. So on today's show, we're talking about, this is going to be a two-part series with Evelyn, and we're going to be talking about kidney disease specifically in these shows, because this is a show about managing chronic health conditions. So the conditions that will go on for more than 6 months, some people say 3 months, some people say 12 months, but it's around 6 months. So if you've got a chronic condition that's going on beyond 6 months, it typically needs a lot of self-management, a lot of self-care. There's only so much, the professionals can do. A lot of it is down to us with chronic health conditions to manage it and to do something about it. And implement what they've asked us to implement to help our condition. So kidney disease, previous to coming on the show, I was looking at kidney disease and the prevalence of it being about 1 in 3, certainly in the US. I couldn't find the stats for Australia, but I'm presuming it's going to be pretty similar. 1 in 3 people are suffering from kidney disease, which is pretty alarming. And it's not something I know a lot about, but I know my guest does, because that's her specialism. So today we're going to be talking about the kind of things today in this first part of that two-part series. We're going to be talking about the kind of things that you can do to actually prevent yourself from getting kidney disease in the first place. You've got a seriously high chance of getting it. And what we're trying to do is help people today in terms of what they can do, the kind of things they can do to help themselves prevent getting to that point. Because a lot of chronic conditions that we have leave us open to developing kidney disease, right? Mm-hmm. So talk us through a little bit about your background, Evelyn, in terms of your interest and specialist in knowing and helping people with kidney disease or preventing it.
Definitely. So I actually have special interest in kidney disease. So in Australia, a dietitian, they don't really have like a special exam to go through, not like in US. So usually in US, you have an exam to go through. Once you pass that, you can call yourself a renal dietitian. But in Australia, it's a bit different. So we don't have that. We don't have that exam for us to go through. So it's all depend on us to further our educations, to look for courses to attend and to gain more experience on this area. So for myself, I guess I would say I have special interest rather than I'm specialized in kidney disease. Yes. So so I have special interest in chronic kidney disease. So chronic kidney disease is when your kidney function is not at optimal level for at least 3 months. So usually, if you have done blood test result, you've done blood test and you get the result. There's a number that you can look at. So there's a marker where it's called EGFR. So if you look at that EGFR, and if that EGFR number is lower than 60 for 3 months, at least 3 months, then there's high chance or most likely you have chronic kidney disease. So that's one very useful things what you can look at. The other thing is when you have protein in your urine. So if you have very foamy urine, then you might want to go and check with the doctors.
Yeah, that's two good tips actually, because people. So we're saying that people may have it, but not necessarily know they have it, right?
Yeah, yes. A lot of the time in Australia, they only will be referred to nephrologists, which is the doctors specialized in kidney, when they are when they have very bad kidney condition. So they
Okay.
are for kidney problem, we divide them into few stages. So from stage 3 up to stage 5. So stage 5 is when you need to go dialysis. So stage 3 is the one that I would recommend people to start looking for help. So stage 3 is when your EGFR is dropping below 60. But a lot of the time, the primary care here, which is the GP, only refer people with kidney problem to nephrologists when they are at stage 4B, when the numbers is really low. Which, when we think about it, if you look at so maybe I want to explain a bit about the EGFR. The EGFR mainly represent the kidney function. So for example, if you have EGFR, say, with a number 60, that means your kidney function, there's only 60% of your kidney is working good. So if you
Okay.
have number 20, that means 80% of your kidney is not function anymore. There's only 20%
Yeah. Okay.
functioning.
So the lower the number, we need to remember the lower the number, the worse the kidney disease functioning is, right?
Yes, definitely. So you really want to prevent your kidney from going down. So if your kidney function is 60 or below, say 55, so there's 55% of your kidney function. So you really want to preserve that moment. So as a dietitian, we have the tool. So I have the tool to help you to prevent your kidney from going down. So if you seek help earlier, the more kidney that you can preserve.
That's awesome. That's awesome information. And we will talk more in the second part of this series about, once you know you have it, how you can push that number back up again, right?
Yes, yes.
Because it's recoverable, is what we're saying. Even if you're going down with losing kidney function, there are a lot of things that you can do to push yourself back up again, to stabilize that kidney functioning to levels which you're not kind of causing yourself even more serious damage. Because the things that you can cause yourself worse damage with, once you have it, but you're not looking after it. And that's what we'll talk about in series 2 too, because I think that's so crucial, that you can't just sit on it and think, oh, doctors are managing it, I don't need to worry about it, because you're actually potentially causing yourself even more serious chronic conditions because of it.
Yes, that's right.
So let's just start with the idea then, that you don't know you've got kidney disease. You're not in that kind of bracket yet, but you have other things, other chronic conditions which might present you as a higher risk of developing chronic kidney disease. Talk us through some of those kind of issues that if you have right now, you should be thinking and considering that if that's not well managed, you may be moving on to that next stage of chronic kidney disease. Yeah.
Yes, so there are a few, we call it risk factors. So if you have those problems, then you are at higher risk of getting kidney issues. So one of the big things is if you have diabetes. So diabetes, so if someone their blood sugar level is not well controlled, what happens is that your nerve will tend to get damaged. And if your nerve tend to get damaged, you will have complications such as kidney problem, because there's blood vessels going through your kidney. So if you have diabetes and not well managed, then you tend to damage your kidney at the same time, so down the line. So if you look at statistic, one in 3 people that have diabetes will end up having kidney failure. So one of them, so it's quite alarming. So one of the problem is if they don't control their blood sugar well. The other problem is that when people have diabetes, they tend to want to restrict their carbohydrate intake. So carbohydrate is something that, for example, if you're eating bread, pasta, fruit, starchy vegetables, those things contain carbohydrate. So when someone has diabetes, a lot of the time, if they don't seek help from a proper dietitian, then they might restrict themselves straight away from eating carbohydrate and go for low carbohydrate, go for keto diet, paleo diet. So what that means is that they start to have a lot of protein and fat.
Right.
Yeah. So the thing about having a lot of protein is that your kidney helps to remove excess protein. So each of us, when we have a meal, we can only take 25 to 30 grams of protein at a time per sitting, per meal. So 25 to 30 grams of protein is like, for example, a palm size, your palm size. Or if you imagine your the mouse PC is just that size. So if you tend to have a lot of meat, a lot of protein, then your body can only use 25 to 30 grams of protein. The rest of the protein, they will remove out of the body through your kidney. So imagine that if you have to process a lot of protein every time, so you are putting your kidney your kidney have to work so much hard just to get rid of it. Yeah, so that's that's also the other main factor why someone with diabetes, they are at high risk of getting kidney problem. So the second risk factor could be hypertension. So hypertension is high blood pressure. So if someone have high blood pressure, then they also at higher risk of getting kidney problem, because if you imagine your kidney and if you have high blood pressure, your blood pressure is always pushing your kidney at constantly. So your kidney is having that push all the time, and it's not good for the kidney. So there's a lot of time people that have high blood pressure, they tend at the end of the day, or toward probably 10 years or maybe less, they might have kidney problem at the same time.
And just stopping off on hypertension, because with my chronic health condition, I never ever had to worry about my blood pressure until I was diagnosed with an autoimmune condition. And I didn't even know until I went to the hospital. It's one of those invisible diseases, is hypertension, that you do not know you've got it. It wasn't until I was going into hospital regularly to get treatment, and they have to take you do the obs before they see you, that I realized how high my blood pressure was, and I would have never known otherwise. And I could have gone on and on and on and on, basically developing what you're talking about now, which is chronic kidney disease and all sorts of other things that you can get from hypertension. So what I was advised to do was to get a blood pressure machine, a home one that you can use to keep monitoring it. And then when you can see the numbers, because that's the only visible thing you've got an objective measure, because you can't really sense it yourself unless you've got some internal signal that you recognize. And I do, but mine's very unpredictable. Sometimes I think I have and I haven't, and sometimes I don't think I have and I have. So that machine has just been a lifesaver, and I'm sure it is for a lot of people around the world. And I would definitely, if you've got a sense that you're at risk of hypertension, even, is to just get your hands on one of those machines, even if it's like secondhand or something, because they are so useful in helping you to know that, you know, a quick measure is to just cut down on your salt intake. That really helps, or to stop eating processed foods, which have got a lot of salt in them. Or what I do, and I find really useful, is go out and exercise, go for a walk, or you know, or on the bike, because that instantly brings it down. But unless I've got that measure to tell me to do that, I wouldn't know to do that. So it's quite hypertension is just one of those invisible things that you just don't know until you've got something telling you. So yeah.
Yes. So definitely to have a machine with you is helping. So you can actually seize, like you can actually seize it, and it gives you an alarm when it's high. So you want to do something. It's actually motivates you to do something if you can see the number. So definitely it is useful.
Yeah,
Yes.
absolutely.
Mm-hmm.
Sorry to cut in and spoil your flow there. I just thought I'd mention that as we were going along.
Yes.
So we were talking about, so we've talked about hypertension and diabetes. Are there any others that you want to mention? I know they're the two main two, aren't they? They're the most common things, but there are a few others. Do you want to just briefly mention those?
Yes. So other risk factors can be if someone is overweight. So if you overweight, so you can actually look at your BMI and see whether you are overweight or not, or look at your waist. So see whether there's any excess fat, or if it is there's numbers that you can look at. So you can see whether you are overweight or obese, or if you do and you have hypertension or high blood pressure, it is good that if you can lose some weight. And there's best practice guideline that says that if you can just lose 5 to 10% of your overall weight, it actually can improve your high blood pressure. So you don't have to lose a lot, just 5 to 10% of your total weight. That already give a medical improvement for your health condition.
That's good, isn't it? That's such a small amount to make such a big difference.
Yeah. And the other thing that I would like to mention here as well is that some medication might hurt your kidney. So the client that I see, there's a lot of time when I notice that their kidney function is not that optimum. And when I look at their medication, a lot of the time they are on some reflux medication, which is what we call PPI, the protein pump inhibitor. So some of the protein pump inhibitor, if you take it for a long time, at least few years, it actually can damage your kidney. So it's not very good for your kidney. So I would suggest that if you are taking this reflux medication for at least few years, maybe you should look at your blood test result, look at your EGFR. Is your EGFR is still above 60 at least? Otherwise, you might want to think of asking your doctor to give you alternatives, or you can always use some diet or some changing some of your lifestyle just to manage your reflux condition. So there are options that you can do. So
it's better, you reckon it's better to find ways of managing the reflux side of things rather than managing the, you know, going into the stage of potentially cause, or being at risk of causing kidney disease. It's better to manage the reflux better first as a preventative measure.
Yes, because if you can manage your reflux better, and if you can change medication, that can help to stop from damaging further your kidney. And it is one of the preventative measures that you can do. So there's the other things is that it's always good to drink enough water. So a lot of the time when I talk to some elderly, they say that, oh, it's quite hard to drink water, especially when we aged. We kind of getting less of the stimulation to drink water as compared to when we are still young. So it's just
I'm
Oh,
drinking here as we're on the show. I went out walking this morning. It was so hot, and I came in, and I'm still feeling dehydrated because of it. And that's just going out for a short walk. But we are in Australia, and it is ridiculously hot at the moment.
yeah. So it is recommended if you can drink at least 2.5 liter a day of water, that will be really good, because if you not drinking enough water, especially when you experience diarrhea, you lose a lot of water and you're not up with drinking water, that will put your kidney at risk. And sometimes you can get that acute kidney problems. Acute means is immediate damage to your kidney. And sometimes if you get acute kidney problem, you need to go to the hospital. And a lot of the time, if you go to the hospital, get treatment as soon as possible, it is reversible. But some of the acute kidney problem, if you don't treat it well, then it will become chronic. And if it is become chronic, it is a permanent thing. So you can't reverse it anymore.
So that's about acting quick on symptoms you have got, getting them sorted so they don't basically take you into that state of that having to deal with something long term. Yeah, sure.
Yes.
But you know, when you say drink water, and I know a lot of people won't drink water because it's boring, and it doesn't, you know, it doesn't taste of anything. Well, it does. Well, I think water tastes of something, but I have a lot of hot water, or water with lemon in it, or you know, herbal teas, which are, you know, are better for you in terms of, especially if you've got conditions where you don't really want to have caffeine and things like that. So there are lots of ways, aren't there, to be creative in terms of putting a little bit of cordial in it, or you know, to spruce it up a bit, spice it up a bit, or fruit it up a bit, whatever you want to do, whatever your bag is, to make that water more enticing to want to drink, right?
Yes, I agree what you said. So I do come across with clients, they have the same problem. They'll just say, oh, I don't like drinking water. So we have to come up with some alternatives. So for some, they are happy to just make their, you know, sometimes they have their water, as you say, they put some fruit slice, lemon slice, or even cut some orange or berries, just put into the water in the fridge for a few hours, then you get that flavor coming through. So that's one way.
Even I have a lot of frozen fruit. Not a lot. I prefer fresh, but things like blueberries and strawberries and mango and things like that. So they're frozen, but you can just put them in as an ice cube, basically, and it just makes it more interesting. And sometimes it colours the water or it flavours it. You know, it just one way or another. You know, if you're at risk of this, you need to drink. You really do. That seems to be one of a big thing to do.
Yeah. And sometimes if you don't have any reflux problems, you might want to consider, I know some of my clients, they like fizzy drink. So what they do is they're happy to make the soda water themselves. So just to make it fizzy, but you don't have any other sugary drink. So it's just water, and then you carbonate it, and then you just drink it. So that's another way that makes drinking water a bit more interesting.
Yeah, it makes it interesting, gives it a fizz rather than a flat feeling.
Yeah.
And it does make it more palatable, because sometimes water is just not palatable sometimes to drink. I've been there where I just couldn't do it. But being creative and having other ideas to make it interesting.
Yes, definitely. And like you say just now, herbal tea can be another alternative as well. Yeah, so herbal tea doesn't have caffeine, but it has that extra additional taste, flavor. So it's another way of trying to drink more water. Yeah.
I bet a lot of people don't recognise the side effects of medication causing chronic illnesses, and that's an interesting one, because people just prescribed it, they sometimes take it for years. Don't think about it. Just let it do its job. Don't change anything else in their life or anything around it. And before they know it, they're kind of where did this new disease come from? But they're not really made aware of the fact that medications, for example, influx. Is it influx? We did say influx.
Reflux.
Reflux, sorry, not influx. That's something else.
If you had heartburn issues, yes.
Yes, so that's kind of bringing acid up, isn't it, into your gullet? And
Yes. The other medication that I forgot to mention is the the painkiller, which is for example the ibuprofen, those strong painkiller. So they also, if you have them, just make sure that you have them when needed, not every day, because those can be quite harsh to your kidney as well. So just be careful when you have when you're taking painkiller, a stronger painkiller like ibuprofen, those kind. It's called it is classified as NSAID, NSAID drug medication. So you can get it over the counter, but just so the takeaway message is when you have medication, just make sure that you have it when needed and when it is under guidance of your doctor. So try not to take any medication or buy any medication over the counter. It's quite, I think you wouldn't know what happens. It might cause harm to your organs or have some side effects. So just a bit careful with that.
That's good advice. And the worst thing I find living in Australia, Evelyn, is that we don't get we don't very often get the information that comes inside the boxes. Whereas in the UK, we relied on that to give us all the side effects, all the information we needed to make an informed decision about whether I do or don't want to take this because of the side effects. Whereas in Australia, I found that really strange when I first came to live here, that you were given a medication and it told you nothing apart from what was on the outside of the box. I find that a bit disconcerting because I have to then go on I'm one of those people that need to go on the internet and have a look. But I'm having to then self-advocate. I'm having to go and find my own information instead of it being pushed to me. And I think that's a big problem for people that don't have time or the inclination or the interest or even the know-how. They don't know they need to go and find side effects of medication. But I don't know. I'm not sure why. I don't know if you know why we don't get these information sheets in boxes in Australia.
I'm not sure myself because I don't really go and buy over-the-counter medication a lot. I don't really realize it, but I assume sometimes you get that information sheet inside the box. I'm not sure whether
that's always missing. Even prescription. I get a lot of prescription stuff and it's not even in there.
Oh, okay, interesting. So there's something that need to be looked into, isn't it?
Strange thing. So people may say, but I weren't even aware. Well, maybe you're not aware because you weren't made aware. You'd have to go and search for these things, which makes it that bit more difficult, I think, for people to be informed about what they should and couldn't and should do. But anyway, that's another show sometime in the future, I expect. It's been awesome having you on today, Evelyn. I really appreciate you coming on, and we're going to do another show very soon, which looks at part 2, which is looking at if you have chronic kidney disease, how you can prevent yourself from going down those numbers and keeping those symptoms that you're having at bay and not developing other chronic illnesses as well.
Yeah.
Because you really don't want that. Once you've already got one, you don't really want another.
Yeah.
So
it's a long battle,
absolutely. And I'm having a guest on pretty soon on the show who has chronic kidney failure. He has not very many numbers in his kidney functioning, and he's on dialysis. So he'll be able to talk about some of the things that you've shared today in terms of what helped him to keep up there and keep his positivity in check. So if people want to contact you in terms of getting some more advice from you, because there's not many people with your level of knowledge, I don't think, necessarily from who I've met anyway, in terms of diet and nutrition, specialist interest in that. What's your the best way for people to contact you?
Or they can always call me. They can always email me. So I'm quite quick in response to people calling me or email me. And you can get those information if you just Google or you can search my website, which is www.rainbownutritionanddietetics.com. So and my number, I have to look at my number. So
Would that be on your web? Is that on your website, Evelyn?
Yes, everything is on my website. So
yeah. So to Rainbow Diet Nutrition and Dietetics.com. Is that correct?
Yes.
And you've got all the details you need to email or to phone to have a chat.
Yeah.
Until next time, I will bid you farewell and I hope you have a great day. And bye to everyone. Thanks for watching, and we'll see you again soon.
Have a nice day, and thank you for having me.
You're welcome.
Okay, bye-bye.